Pay close attention to what I'm about to tell you because it may explain something you've been experiencing for months, maybe even years. Have you ever found yourself thinking twice before climbing a flight of stairs? Have you felt like your legs simply don't have the same strength they used to? Or worse, have you had that moment of uncertainty, that split second of hesitation before taking a step because you're afraid of losing your balance? That's not being overly sensitive. It's not all in your head. And it's definitely not something you should accept as normal just because you're over 60. What you're experiencing has a medical name. It's called sarcopenia, the age-related loss of muscle mass. And it begins completely silently, often without pain, without warning, and without any obvious symptoms. Most people don't notice it until they've already lost a significant amount of strength. And the legs are usually the first place where the decline becomes noticeable. The good news, and there is very good news here, is that recent research from Harvard and Tufts universities has shown that this process can be slowed down and in many cases partially reversed through specific dietary changes. Not expensive supplements, not complicated diets, just foods that you probably already have at home. Today, I'm going to show you the 6 most powerful, scientifically proven foods for strengthening leg muscles after age 60. And the number 1 food on the list will surprise you because it's the simplest, cheapest, and most accessible food there is, and most people aren't using it correctly. Stay with me until the end. What I'm about to share is worth more than any private consultation. But before we continue, I need to ask you for one simple favor. If you value serious medical information that is free, straightforward, and backed by science, click the like button right now. That simple action tells me this content is reaching the right people, and it's the fairest exchange you can make for the knowledge I'm about to share. And if you're not subscribed to this channel yet, do it now before we continue. Click subscribe and turn on notifications. Every week I publish medical content created specifically for people over 60 who want to live with real strength, balance, and independence. Subscribed? Great. Then let's begin. Before we get into the foods themselves, I need you to understand one fundamental concept. Because without understanding this, you could eat all the right foods and still see little to no results. After age 40, the human body begins losing between 1% and 2% of its muscle mass every year. That may not sound like much, but by the time we reach our 60s and 70s, that silent accumulation represents a massive loss. And I'm not talking about appearance, I'm talking about the strength you need to stand up from a chair without assistance, to walk confidently, to climb stairs without gripping the handrail with both hands. Sarcopenia is directly linked to a higher risk of falls in people over 60. And falls, in this age group, are one of the leading causes of hospitalizations, hip fractures, and permanent loss of independence. What conventional medicine often doesn't emphasize clearly enough is that nutrition is one of the most powerful tools available for fighting sarcopenia. Not just protein, which everyone already knows is important, but specific compounds found in everyday foods that directly support the regeneration, protection, and strengthening of muscle fibers. That's exactly what we're going to talk about today. I'm going to present the 6 foods in ascending order of impact, from number 6 to number 1, and I guarantee that number 1 will change the way you look at your kitchen every day. Number 6, sweet potato. Sweet potato is what I like to call a long-lasting fuel source for your muscles, and that distinction matters a lot. After age 60, the muscles in your legs no longer store and use energy as efficiently as they once did. This happens because of a process called peripheral insulin resistance. In simple terms, muscle cells become less efficient at absorbing the glucose they need to function properly. The practical result is that familiar fatigue in your legs that shows up much sooner than it should. Heavy legs in the middle of the afternoon. Difficulty keeping up your pace during a walk. Sweet potatoes solve this problem in an elegant and completely natural way. They are rich in low glycemic complex carbohydrates, which means they release energy slowly and steadily, without the dramatic spikes and crashes in blood sugar caused by processed foods. For your leg muscles, this translates into stable energy that lasts for hours. But what makes sweet potatoes truly special for muscle health goes far beyond energy. They are one of the richest sources of beta-carotene, the precursor to vitamin A, which the body converts as needed. Studies published in the Journal of Nutritional Biochemistry have shown that beta-carotene has direct anti-inflammatory effects on skeletal muscle fibers, helping reduce inflammatory cytokines that accelerate muscle breakdown. Sweet potatoes are also an excellent source of potassium, a mineral that is essential for proper muscle contraction and relaxation. Potassium deficiency is directly associated with muscle cramps, weakness, and the stiffness in the legs that many people notice when they wake up in the morning. and the soluble fiber found in sweet potatoes improves gut health. That may seem unrelated, but it has a direct impact on the absorption of the nutrients your muscles need. How to eat it: baked in the oven, mashed with minimal salt, or added to soups and stews. 2 to 3 servings per week are enough to begin experiencing the benefits. Number 5. Oatmeal. Most people think of oatmeal as a simple, inexpensive breakfast food, and yes, it is. But for someone over 60 who is fighting the loss of strength in their legs, it's much more than that. Let me explain why. As we age, many people develop what is known as subclinical iron deficiency anemia. Their iron levels fall slightly below optimal without them realizing it because the symptoms are subtle. Fatigue that seems normal, legs that feel heavier than they should, shortness of breath during mild physical activity. Oatmeal is one of the richest plant-based sources of bioavailable iron. When consumed regularly, especially alongside vitamin C from fruit, it can significantly improve oxygen transport to the muscles of the legs. More oxygen in the muscles means greater endurance, less fatigue, and faster recovery after physical activity. But the most impressive benefit of oatmeal for muscle health comes from a nutrient that is rarely discussed: magnesium. An 80-gram serving of oatmeal provides approximately 50 milligrams of magnesium. Research published in the American Journal of Clinical Nutrition has shown that magnesium deficiency is extremely common among adults over 60, affecting more than 60% of this population, and is directly associated with nighttime muscle cramps, leg stiffness, and progressive loss of strength. Magnesium regulates more than 300 enzymatic processes in the body, including muscle contraction and relaxation. Without enough magnesium, muscles remain in a constant state of tension. That's where the cramps come from, the stiffness, the feeling that your legs never fully relax. Oatmeal also contains beta-glucan, a soluble fiber that helps regulate blood sugar levels and improve nutrient absorption. Indirectly, this helps ensure that your leg muscles receive a steady supply of the nutrients they need. How to eat it: in the morning with berries and honey, as an afternoon snack, in smoothies. The key is consistency, at least 5 days per week. Number 4. Avocado. If you're over 60 and wake up with stiff legs, unexplained knee discomfort, or the feeling that your joints are becoming rusty, I need you to pay very close attention to this food. Because the underlying problem behind many of these symptoms is something most people have never heard described properly. It's called chronic low-grade inflammation. Unlike acute inflammation, which happens after an injury, chronic inflammation is silent and persistent. It slowly wears down muscle fibers and joint tissue over the years without causing enough pain to send you to the doctor. Avocados are among the most powerful anti-inflammatory foods available. They are packed with monounsaturated fatty acids, especially oleic acid, the same beneficial fat found in extra virgin olive oil. These healthy fats directly help suppress the production of pro-inflammatory compounds that drive chronic inflammation throughout the body. Research from the University of California has shown that people who regularly consume avocados tend to have significantly lower levels of inflammatory markers such as C-reactive protein compared to those who do not. But there's another nutrient in avocados that is absolutely essential for muscle health and rarely discussed: potassium. Avocados actually contain more potassium per serving than bananas. And as we've already discussed, potassium plays a vital role in preventing cramps and ensuring proper muscle contraction. In addition, avocados are one of the few fruits rich in glutathione, often called the body's most powerful antioxidant. Glutathione helps combat the oxidative stress that accelerates age-related muscle deterioration. How to eat it: sliced with olive oil and a pinch of salt, spread on whole grain bread, or added to salads and soups. Half an avocado per day is enough to provide meaningful benefits. Number 3. Berries and purple fruits. Now we've reached a group of foods that I consider some of the most underrated nutritional tools for healthy aging, and I'll explain why with a simple analogy. Imagine your muscles are like a city. Every day, traffic moves through the streets. Those vehicles represent free radicals, the natural byproducts of cellular metabolism. In a young city, the infrastructure handles the traffic well. But as the years pass, the roads become more fragile, and the constant wear and tear starts causing damage faster than the city can repair it. Berries and purple fruits, blueberries, strawberries, raspberries, blackberries, and acai, are like an elite maintenance crew for your muscles. They are among the richest natural sources of anthocyanins and flavonoids, powerful compounds that neutralize free radicals and reduce oxidative damage to muscle fibers. A study published in the Journal of the International Society of Sports Nutrition found that people who consume blueberries before and after exercise experienced significantly faster muscle recovery and less oxidative damage compared to a control group. These benefits were observed regardless of exercise intensity. For adults over 60, this translates into something very practical. After a walk, after gardening, after any physical activity, the muscles in your legs recover more quickly when berries are consumed regularly. Less soreness the next day, less stiffness, more readiness to move again. Berries are also rich in vitamin C, which stimulates collagen production. And collagen isn't just important for your skin, it is essential for the integrity of tendons, ligaments, and the overall structure of your muscles. There's also an additional benefit that surprises many of my patients. The same anthocyanins that protect muscle tissue are capable of crossing the blood-brain barrier and exerting protective effects on the brain. Regular berry consumption has been associated with a lower risk of cognitive decline. In other words, you're not only strengthening your legs, you may also be helping protect your memory. How to eat them. Add them to your morning oatmeal, mix them into plain yogurt, blend them into smoothies, or enjoy them fresh as a snack. A handful per day, 5 to 7 days a week, is an excellent goal. We've now reached the halfway point of today's video. And before I reveal the 2 most powerful foods on this list, foods that are absolutely essential for the health of your legs, I need to ask you for something. If you haven't subscribed to this channel yet, do it right now. Click the subscribe button and turn on notifications. Every week, I publish serious, science-based medical content created specifically for adults over 60. Don't miss the next video, because it may be even more important than this one. Now let's move on to the 2 most powerful foods on our list. Number 2, salmon. When I speak with patients over 60 about muscle strength, one of the first questions I ask is, how often do you eat fish? And most of the time the answer is, not as often as I probably should. That matters more than most people realize, because salmon and other fatty fish such as sardines, mackerel, and trout contain a combination of nutrients that simply cannot be fully replicated with supplements. The first component is high-quality protein. Salmon is a complete protein source containing all 9 essential amino acids in ideal proportions for muscle synthesis. As we age, the process of muscle protein synthesis, the body's ability to build and repair muscle fibers, becomes significantly less efficient. Older adults need more high-quality protein to achieve the same muscle-building response that younger adults get with smaller amounts. A 150-gram serving of salmon provides approximately 34 grams of highly bioavailable protein. In other words, protein that the body can absorb and utilize extremely efficiently. But the true advantage of salmon lies in its omega-3 fatty acids, particularly EPA and DHA. These compounds possess 2 remarkable properties that make them exceptionally valuable for muscle health after age 60. The first is their powerful anti-inflammatory effect. EPA helps suppress inflammatory pathways in the body, the same pathways targeted by many anti-inflammatory medications, but naturally and without the gastrointestinal side effects. Less inflammation in muscle tissue means less pain, less stiffness, and faster recovery. The second property is something researchers refer to as omega-3 mediated muscle anabolism. Studies from the University of Washington have demonstrated that omega-3 fatty acids improve the sensitivity of muscle cells to anabolic signals generated by insulin and amino acids. Put simply, when you consume omega-3s regularly, every gram of protein you eat becomes more effective at rebuilding muscle. Salmon also provides vitamin D, a nutrient that plays a critical role in muscle function and is commonly deficient in adults over 60, especially those who spend little time outdoors. Vitamin D deficiency is directly associated with muscle weakness, cramps, and an increased risk of falls. How to eat it: 2 to 3 servings per week, grilled, baked, or canned in olive oil. If fresh salmon isn't easily available, canned sardines are an outstanding and much more affordable alternative with a similar nutritional profile. Number 1, eggs. And now we've reached number 1, the most powerful, complete, and underrated food for muscle health in people over 60. Eggs. I know you've heard about eggs before. You probably eat them from time to time, but I would bet that you're not consuming them in the most effective way for the health of your legs and muscles. And that's exactly what I'm going to explain right now. Eggs are the only food that nutrition researchers use as the reference standard for measuring the protein quality of all other foods. This standard is called the PDCAAS, Protein Digestibility Corrected Amino Acid Score. Eggs receive the highest possible score, 1.0. No other natural food surpasses that rating. What does that mean in practical terms? It means that the protein found in eggs is absorbed and utilized by the body with maximum efficiency. When it comes to rebuilding the muscle fibers in your legs, eggs are simply one of the most efficient foods available. But protein is only the beginning. The yolk contains a nutrient called choline. Most people have never heard of it, yet it is absolutely essential for communication between your nerves and muscles. Choline helps ensure that nerve signals reach the muscles quickly and accurately, allowing for coordinated and controlled movement. As we age, neuromuscular communication becomes less efficient, movements become slower, less precise, balance begins to decline. The choline found in egg yolks helps support this communication system, contributing to steadier steps, better balance, and greater confidence in every movement. Eggs are also one of the few natural food sources of vitamin D, which, as we've already discussed, is essential for muscle function. They are also rich in vitamin B12, a nutrient whose deficiency becomes increasingly common after age 60 and is associated with muscle weakness, chronic fatigue, and even neurological changes. A meta-analysis published in the European Journal of Nutrition in 2021 examined data from more than 150,000 adults over the age of 60. The researchers found that regular egg consumption, between 1 and 2 eggs per day, was associated with better preservation of muscle mass and a lower risk of sarcopenia compared to people who rarely ate eggs. Now I need to address a myth that still persists today and causes many older adults to avoid one of the healthiest foods available. The myth that eggs are bad for your heart because of cholesterol. Science has evolved significantly on this issue. The latest guidelines from the American Heart Association and leading European cardiology organizations recognize that dietary cholesterol from eggs has only a minimal impact on blood cholesterol levels in most healthy individuals. What significantly raises cholesterol levels are trans fats and excessive amounts of saturated fats, not eggs. For adults over 60 without severe uncontrolled hypercholesterolemia or unmanaged cardiovascular disease, consuming 1 to 2 eggs per day is generally considered safe and highly beneficial. How to eat them: scrambled, boiled, poached, or in an omelet with vegetables. The key is consistency. Aim for 4 to 7 servings per week. At this point in the video, I want to pause and ask you a direct question. Have you ever felt overwhelmed by all the contradictory information about nutrition? One week they tell you eggs are bad. The next week they're called the perfect food. One day avocado is supposedly fattening. The next day it's considered essential. I understand that confusion, and that's exactly why this channel exists. In the comments below, type the word strength right now. Not just any comment, specifically the word strength. That tells me you've made it this far, that you're committed to your health, and that my work is reaching the right people. Type strength in the comments right now. I'll be looking for it. Now let me give you something practical that you can start using this week. The goal isn't to eat all 6 foods every single day. The goal is consistency throughout the week. Monday and Tuesday, start your day with oatmeal and berries. At lunch, include sweet potatoes as a side dish. Wednesday and Thursday, make salmon or sardines your primary protein source. Add half an avocado to your salad. Friday, Saturday, and Sunday, eggs, and more eggs, in any preparation you enjoy. Throughout the entire week, berries can be included with any meal. They're versatile, quick, and require virtually no preparation. And there's one final component I can't leave out, because without it, these foods work at less than half their potential. Movement. I'm not asking you to join a gym. I'm not asking you to run. I'm talking about short walks, 20 minutes a day, gentle leg stretches in the morning, simple exercises while sitting in a chair. Movement activates the body's muscle-building mechanisms. Without physical stimulation, even the best foods become less effective. With regular movement, even light activity dramatically enhances the benefits of the nutrients you're consuming. Nutrition provides the fuel. Movement ignites it. Together, they rebuild your legs from the inside out. If you've stayed with me until this point, I want you to remember something important. The leg weakness that so many people experience after age 60 is not an unavoidable destiny. It is not a life sentence. It is a biological process that, when understood and addressed with the right tools, including the nutrition we've discussed today, can be significantly slowed and, in many cases, partially reversed. I've seen patients in their 70s and 80s regain strength, balance, and confidence through relatively simple changes in their diet and lifestyle, not overnight, but with consistency, patience, and the right knowledge. And now you have that knowledge. Subscribe to this channel if you haven't already. Turn on notifications, and share this video with someone you care about, a family member, a friend, or anyone you see gradually losing strength and independence. Sometimes sharing a video is a genuine act of care. And before you leave, make sure you watch the next video on this channel. The topic is just as important for anyone over 60, and what I'm about to reveal there may completely change the way you approach your health. Take good care of yourself. Stay strong, stay independent. I'm Dr. Joseph Barrett, and I'll see you in the next video.